If you have been diagnosed with heart failure, you are not alone. It affects more than 64 million people worldwide. The simplified definition of this disease is that it is a condition when the heart cannot pump efficiently enough to circulate oxygen-rich blood throughout the body. Certain conditions cause the heart to become weak or it becomes thickened, and the heart muscle cannot keep up with its workload. Signs and symptoms that most people experience with heart failure include swelling, particularly in the lower parts of the body. Shortness of breath is another common symptom of congestive heart failure that occurs due to fluid buildup in the lungs. And fatigue and a decreased capacity to exercise are other symptoms that commonly result from this condition. Early symptoms and signs may not be apparent, and symptoms may develop only after the condition has progressed over time. Symptoms are usually worse at night or any time that a person lays flat. The most common risk factors for heart failure include high blood pressure, history of heart attack, obesity, smoking, alcohol abuse, sleep apnea, heavy metal toxicity, poor nutrition, and being sedentary. There are 4 stages of heart failure, used to classify the severity of symptoms. These stages range from high risk of developing heart failure to advanced heart failure. Heart failure treatment includes multiple approaches such as lifestyle and diet changes, prescribed medications, and sometimes implanting devices. In the most advanced stages, heart transplant may be needed. Medications can help reduce the symptoms of congestive heart failure and improve heart muscle function. The prognosis will vary from one individual to the next. However, if one does not make the appropriate lifestyle changes, take their medications, or if the underlying causes are not correctable, heart failure can become a progressive and ultimately fatal condition. Although this is a serious condition that progressively gets worse over time, certain cases can be reversed with the proper treatment. Even when the heart muscle is impaired, there are treatments that can relieve symptoms and slow the worsening of the condition. Let's discuss how heart failure is diagnosed. A diagnosis is determined when a physical exam or chest X-ray confirms reported symptoms. An echocardiogram test can identify a stiff or thickened heart muscle. Echocardiograms can also distinguish between different types of heart failure. There are blood tests that can determine heart failure. Doctors have guidelines to score and weigh signs and symptoms to help make the diagnosis. Let's discuss how heart failure can be prevented. Your risk of contracting this disease is dramatically lower if you never have a heart attack, but if you do, there still are treatments. Research reveals that a Mediterranean diet can prevent heart failure among people who have had a heart attack. It's important to follow other healthy lifestyle recommendations such as not smoking, not abusing alcohol, eating a mostly plant-based and antioxidant-rich diet. People with heart failure must also limit their intake of salt. When you eat a lot of salt, it causes your body to retain fluids. When fluids build up in your body, it increases your blood pressure and puts even more strain on your heart. Your doctor may refer you to a dietitian to help you learn how to cut back on sodium and make other changes to your diet. We will have more information on an appropriate diet for heart failure patients in our next video. We need to know if this information is important to you. If you are learning anything, please give this video a like. In heart failure, this is particularly important as sodium can make heart failure symptoms worse. It can also have long-term effects on the kidneys and heart. Being physically active every day may also help prevent heart failure. It's important to treat risk factors such as high blood pressure or being overweight or obese. Managing stress is essential. This may require learning stress resiliency techniques such as meditation or yoga. You should seek medical treatment right away if you experience severe shortness of breath, a cough with foamy mucus, chest pain, fainting or extreme weakness, rapid or irregular heartbeat with chest pain, breathlessness, or fainting. If you are diagnosed with heart failure, the frequency of your doctor visits will depend on the specifics of your condition. Ask your doctor how often you should see them, and you should always make your follow-up appointments. Over time, your doctor will determine whether you need to be seen more or less frequently. Consistently keeping up with your heart failure treatments is crucial to managing your health. Frequently forgetting to take your medicine or not following your doctor's instructions can lead to worse symptoms and increase your risk of poor outcomes. Remember, there are many steps you can take to manage your heart failure. A good start is to maintain a low-sodium diet and to stay physically active. Your doctor can help you evaluate the best ways to reduce your risk of developing heart failure. We have enjoyed bringing you another video, and thank you for watching this to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. If you are over 40 and have questions about heart failure, it's important to consult with your physician to ensure that you have a clear understanding of your personal situation from a medical or mental health standpoint. If there is a health or wellness subject you would like to know more about, leave us a comment and we'll be happy to put together a video.